Alrighty, and we're back. Thanks everyone for tuning in to PNN for our group's latest research behind Peru. After a long week here in Peru, we have actually found out many things about it. Through analyzing the burden of disease, we have found that non-communicable diseases are actually the greatest threat here. Through looking at the top causes of death, the three major causes are waterborne bacterial disease, cardiovascular disease, and dengue fever. We came to the conclusion that these three are the greatest causing of death here in Peru. Our team has found a way to decrease the prevalence of these three diseases and increase the living standards of civilians here in Peru. The people we are targeting are people below the poverty line where their living conditions are actually unsanitary. Now on to Lisa for further information about how to improve waterborne bacterial diseases.
Thanks, Guravir. So, waterborne diseases are of high cause for concern for the people in Peru. They are caused from a variety of factors such as microorganisms and chemicals in the water that people are drinking. They are communicable diseases such as schistosomiasis, malaria, and other water-related vectors. They are diseases that are transmitted through the orifice of the mouth, the nose, and the eyes, and if not treated can be fatal. So the importance of water cleanliness is completely crucial to prevent future illness to the vulnerable groups in Peru, for those affected with lower income. Also, waterborne diseases are critical to a country's health because it is the children that are often most affected by them. So, our group suggests that to immediately fix this pending issue, a fitting recommendation is to simply install simple water systems in rural areas to ensure a safe water supply in diseases such as schistosomiasis, malaria, and other water-related vectors. They are diseases that are transmitted through the orifice of the mouth, the nose, and the eyes, and if not treated can be fatal. So the importance of water cleanliness is completely crucial to prevent future illness to the vulnerable groups in Peru, for those affected with lower income. Also, waterborne diseases are critical to a country's health because it is the children that are often most affected by them. So, our group suggests that to immediately fix this pending issue, a fitting recommendation is to simply install simple water systems in rural areas to ensure a safe water supply in low-income areas. And so for this to be possible, both financial and human resources are needed to be sought out and fund for the water systems and the action plan of installing these systems. So thank you, and on to you, Jazz Karan.
Thanks, Lisa. It is believed to improve the health situation in Peru, not only will school-wide organized sport teams be required, but also improved infrastructure. By having both boys and girls playing on school-wide soccer teams, not only will they have a fun way to spend their time outdoors, but also maintain healthy physical bodies. In addition to this, it is believed that having a greater number of medical clinics around Peru and also placing them wisely around different areas where they are required can improve the health situation. Because of inequality and accessibility with medical clinics, having more of them and having them placed closer to the patients can greatly improve the situation that has been hurting this country and its patients for so long.
So here, ladies and gentlemen, is an example of a proper garbage disposal system, which we should have in Peru. So these things right here are bed nets, and they come in all sorts of colors, and they could prevent any mosquitoes from biting you at night or even at day. However, having a proper garbage disposal system wouldn't keep all of them away, but it would lessen the amount of all those mosquitoes. Those bed nets right there didn't cost that much to produce, so it wouldn't be that much of an investment for the government. But they actually keep us safe from all those mosquitoes flying around in our homes or even outside. So if they can bite us, we won't get dengue fever. It's as simple as that. Now, on to you, Gubir.
Alrighty, and now thanks, Parmeet. Now that you've heard all of our team's recommendations, it's time to put these to work. Three major health issues outlined that were waterborne disease, cardiovascular disease, and dengue fever. They are significantly affecting the health of the Peruvian population, and that's why our action plan needs to be implemented. We need the help from the government because the benefits of installing these systems in rural areas outweighs the financial cost, as the health of the citizens will be dramatically improved. For health clinics, we need stakeholders of health clinics to hire more labor so physicians can be highly accessible to everyone. Garbage disposal system is a one-time investment that needs to be made by the government to ensure sanitation and health of the country. Now that you have heard our team's recommendations, we hope we have your support in making this reality for the people of Peru. Thanks everyone for tuning in to PNN. We'll see you tomorrow, same time.